That sounds so obvious, and yet that's not what most people do in practice. So pre-qualification is one of the most important things. By putting out a message that's going to attract the type of client you want. Let's be specific. If you're only putting out a message about musculoskeletal relief, it's not likely you're getting people who are looking for any type of long-term health care. They're typically looking for quick relief. So if you want to have the type of practice that is what is known as a revolving door type practice, where people come in for quick relief, you offer them that quick relief, then the consequences of that mindset, of that business, is that you're always going to need new people walking in because you're always going to have people walking out. That is a choice, not the only option for chiropractors moving forward. And I think that's one of the first things to highlight, is that doctors have the ability to make sure they're putting out the right type of message. In crude terms, if you're trying to catch a certain type of fish, you'd make sure you put out the type of food that that fish would want. It's not much different. If you're looking for people who are short-term thinkers, looking for quick pain relief, then that's the message you put out. The problem, the challenge, the stress comes into play when chiropractors are putting out a message of short-term relief, but hoping that people come in with an expectation of wanting long-term corrective care. And I think that's the number one place most chiropractors find the most stress, is that they're not bringing into their practice the type of people that would want to come to their practice and stay in their practice.
Well, why is the messaging so hard? I think this is something a lot of docs struggle with, is they don't want to feel as though they're limiting who they're speaking to, when, of course, the irony there being is the more that they do that, the clearer it is for that person to say yes. But why is it such a challenge? I think it's a challenge for all businesses as well, is that we just have this natural pull to the middle, which is vanilla and nothingness, as opposed to specificity. Why?
Chiropractors typically are not trained to be great communicators. We're trained to be great adjusters, trained to be caring and compassionate human beings who care for people. You know, when we talk about the business of healing, we have to acknowledge that there's almost a contradiction in those two concepts themselves. So chiropractors tend to be loving people who want to care for people, who can use our hands in order to enhance people's lives at no real out-of-pocket cost or expense. We don't have to buy a product to resell a product. That creates a mindset that for most people, we just want to help as many people as we can, put our hands and help them improve their lives as much as we possibly can. But that's not how you run a successful business. That is the way you have the right attitude to attract people. What you're referring to, though, is really taking the extra step, as you said, to pre-qualify people. What that means is to really give people the knowledge of what options they have to take advantage of the services you offer. And I think that's a step most chiropractors tend to skip. And the reason they tend to skip it is because it takes a little bit of time, takes a little bit of confrontation at some level. But the benefit of that is it eliminates the guessing. If you want to make your practice easier, more profitable, more fun, and experience more freedom, then check out Patient Pilot's weekly reactivation emails to pilot more of your past patients back into your practice. Check them out at thesmartchiropractor.com.